So my name's Karen, and today we're going to work on some exercises to open up the shoulders and the chest. So really important, obviously, if you're going for your breast screening, but just generally for your own health. So sit up tall on the chair to start with. You can also do this one standing up if you didn't want to be doing it sitting down. And to begin with, we're just going to take some slow shoulder rolls. So we're going to breathe in through the nose and out through the nose. So take a breath in and just roll those shoulders up, and breath out and roll them back. So we're going to do 4 nice shoulder rolls. And you really want to pick the shoulders up as much as you can towards the ears and then press them down at the back. And this may be a little bit uncomfortable, but the more you do it and the more you practice, the easier it will become. So 4 nice shoulder circles backwards, and then relax the shoulders down. So you could do that one while you're boiling the kettle, waiting for a bus, sitting in the doctor's surgery waiting for your appointment, or whenever. It doesn't have to be something that you fit into your day as a separate practice. Then we're going to try and open the chest up a little bit more. So on the chair, you can either hold onto the chair or you can place the hands on the back of the bottom, especially if you're standing up, just on the back of the bottom. We're going to take a deep breath in and squeeze the shoulders back, squeeze the shoulder blades together. So breath in. And when you're ready to breathe out, just relax. Give the hands a shake if you want, circle the shoulders. We're going to do this one 3 times. So you might want to hold the chair and you can just squeeze the shoulders back. Keep nice and tall. And then breath out and relax. And again, maybe just circle the shoulders. And we'll do one more, hands on the back this time. Take a deep breath in, squeeze back. So we're opening across the chest. And then breathe out and relax. And you can hold that one a little bit longer if you want to, but just start off with that in and out. So if you have a Pilates ball or a Pilates band, there are a couple more exercises that you can do to try and open this chest up and strengthen and to release into the shoulder. So we're going to start off with an exercise that's called Rock the Baby. So if you've got a ball, you've got a Pilates ball, you want it a little bit squidgy, you're going to place it underneath the armpit. This is really good for breast health. Place it underneath the armpit, just support your elbow with the other hand, and we're just going to take a deep breath in and out, and we're just going to rock into that breast. So you want a little bit of pressure, not too much. You maybe do 5 or 6 rocks, and then relax. And then again, 5 or 6 rocks. Might feel a little bit of tension in the back. But that's just because we're moving it a little bit, we're working it. So just releasing into here. And this one's really good for the lymph glands as well. Then you can take it underneath the other armpit, wrap it around. So again, a little bit of pressure, just moving into that shoulder. So 5 or 6 rocks, and then relax. And again, 5 or 6 rocks. And relax. You should feel it starting to move this shoulder here. Second one we can do is with the band. You could do this with a pair of tights if you haven't got a band. So you could just get a pair of thick tights, make it into a little loop. And then as your elbows are going to be in close to the side of your body, and you're not moving it far, you're just opening that arm up. So just a little opener. So breath out, breath in. And then the opposite side. Keep that belly pulling towards the spine just to protect the back. And it's good with the band because you're strengthening into the shoulders, so you should feel them working here. You can do it without the band and just open out. So if you are particularly tight in the shoulders, you can do it without the band to start with. And this one's called dumbwaiter. So again, it's a good one for opening up the chest, for if you're going for any breast screening, but just generally for health, just for getting those shoulders moving. And then finish off with some nice shoulder rolls again. Just 3 or 4, deep breath in, slow breath out. And breath out. just have a little go.